Sorry. Rolling.
And no. All right. So I'm going to do what first?
Wash hands.
Wash my hands. Hand hygiene. Come in. Introduce myself to my patient. Verify what?
Name and date of birth.
Name and date of birth with
Allergies.
allergies, and if she has any allergies,
What are
they?
they?
What happened?
what's the reaction?
Okay.
Correct. What are they and what's the reaction?
What happens?
Gonna do my general survey. She looks to be nice and comfortable. She's sitting erect. She doesn't seem to be having any cardiac or pulmonary issues going on. Her color is even and what's the word? Inconsistent, but she looks like she's oxygenating well. Her lips are pink. They're not bluish or discolored in any way. Okay. So now I can go ahead and do what? Level of consciousness. Can you tell me where you are, why you're here, and today's date? Or at least even the day of the week. If they can tell me it's Tuesday, we're golden. Okay? Then what?
Vital signs are within normal range.
Vital signs are all within normal range. Hopefully.
And then you're on.
And then you're on.
So what's the first step?
Any obvious signs of cardiovascular issues?
No edema.
Yeah, I said no edema. She looks comfortable. Doesn't look like she's having a hard time breathing, which we don't normally associate with cardiac, but cardiac and pulmonary kind of go hand in hand in that respect.
No shortness of breath.
No, she looks nice and comfortable, right?
Can we, just for a second, act like Allie is having some issues?
Well, let's go through a
She's using her accessories.
action.
Somebody
And
get a
she's
brown
doing
paper
what?
bag.
She's retracting too.
Yeah.
We're gonna pass out.
I know, right? She's gonna build up that CO2 real quick.
We're gonna have a real respiratory distress here.
But let's go through normal first and get that one down. Okay?
Inspection palpate the neck
Mm-hmm.
for carotid
So-
pulse.
Yep, I'm gonna look at her neck and see. And of course, while I'm here, I'm also going to palpate
Lymph nodes.
for lymph nodes. Now, we've already done that in head, ear, size, nose, and throat. So, I'm not gonna have you look, here's the pre-oracle, okay. But just, know what you're trying to look for, and if anything comes out of hand, or out of left field, I guess you could say. Notice, though, too, I'm not palpating anything other than her lymph nodes right now. I'm not gonna do her carotids.
Because when you do it, you know what?
You only do one side at a time. Okay, I got nice carotid pulse on her left. And a nice one on her right. So now I can take my stethoscope using which side?
The bell.
Bell.
The bell side, and listen in that where I felt the pulse. Okay, the carotid pulse, and listen for a bruit. Now I'm going to hear because blood's flowing through there. Okay, a bruit though sounds completely different, and it's almost amplified of that whooshing sound. Almost sounds like wind blowing.
Is it like a forceful amount of pressure going?
Mhm.
That's what it's like.
And that's usually related to like carotid stenosis, and that's a bad thing. That's the hardening of the arteries.
You don't want to
You do not want to hear a bruit.
Wait, oh, you don't want to hear a bruit?
Nope.
Okay. That's unexpected.
Correct, but hearing the pulse, that's okay.
Okay.
But if you hear a bruit or like swishing or wind blowing sound, like
It's not good.
that's bad. Okay, so we don't want to hear that. So now we've done the neck. We've got our we got good carotid pulses, no bruits.
This is for JVD.
Checking her for JVD. Now I would normally, if the bed was working, I would have her laying back at this point.
What height it be? Do you want us to say that? It's like she's sitting up like this and
Just for this.
Yeah, just
Yeah,
for
but
this. You wanna
if your bed's not working,
Mhm.
just say I would have her at what degree?
45.
45, 30 to 45. I think that the PowerPoint said 35 to 45, but
It was 30 to 45.
30 to 45. That's close enough. And I would have her turn her head, and I'm going to be looking right in this area. So you've got your cleidomastoid ligament right here, right? And I'm going to be looking in this area for any type of pulsation. And that would give me the positive indication of JVD. Okay, and if I'm thinking that there might be, turn the lights off, and that's when you bring out your pen light to see if there's any movement. Okay, and so we've done that. The right side was negative. We're gonna do both sides.
I don't know. Yeah, just one.
Just the
one.
Just the one on the right. Okay? Then what?
Inspect and palpate the precordium for pulsations.
Okay, so where's your precordium? It's your manubrium and your sternum, right in here. Okay? So I would take my hand and place it here, kind of across that whole area to see if I feel any thrills or heaves. Okay, and remember the thrills it would feel like a cat purring. You know what I mean? Those vibrations. A heave you would see more so with like each beat of the heart.
Is that what the video was?
Okay. Yep. And you shouldn't feel either of those. Okay. So then now I've inspected, I've palpated. Am I going to percuss?
Is it just that one spot? No, we don't percuss.
For the precordium? Yep, pretty much everywhere around this. Correct. The precordium, yep. Alright, so now,
Ow.
actually,
Over the 5 auscultatory sites.
awesome. And you need to do them in order, and you need to verbalize which one you're listening to, and which one you best hear S1 versus S2. Okay? I'm going to come around this one. Now, I will say too, never sit on your patient's bed because you never know what's on your uniform. Okay? But we're in lab, this is class. Okay? And to make sure everybody can see, I'm just going to be over on this side. So, we have on Allie here, she has her chest, and she has her suprasternal notch right here. And right below that, we can feel the manubrium, and there's a little ledge that goes straight down. So right there is where her sternum is. And then up here is her manubrium. So that little ledge right there, I'm gonna go right over to her right. And I should be in that second intercostal space. If you have any doubts, come up to the clavicle and feel underneath there. That's the first intercostal space, and then your next finger down will be the second one. So basically 2 fingers down, okay? But you wanna start on the right side and work over to your left and then down. So over here, we had that acronym, do you guys remember? There was 2 actually this morning that we talked about.
How people
Enjoy Time Magazine, or,
Tissue your assets.
nope, that's blood flow through the valves.
I remembered it.
Tissue paper, my assets. I have to say that is a pretty good one. But ape to man, APETF. Okay, so this would be aortic. So we're assessing the aortic valve, and actually it's S2.
Oh.
You can hear S2 better up here.
Say that?
Yep.
Shoot, okay.
Yep.
So aortic.
I know you would think that this would be S1.
Yeah.
But remember, the heart is upside down. The apex is towards the bottom and the base is towards the top. So it's S2. That helped me because you would be 1 floor, 2 floor, whatnot.
Another way
Okay,
to
but
remember
1 floor,
it
2 floor.
is that it's like the second intercostal space, and it's like the first thing you're doing.
Yep.
So the 2's match.
So then that's the aortic. Okay, I'm going to come directly across to the left sternal border, second intercostal space, and now I'm going to be listening to which valve? Pulmonic.
Is that S2 too, because it's in the second intercostal? Of course not.
It's S1. Dang it. S1?
S1
No, not
doesn't
yet.
have a sound.
Oh,
Doesn't have a
gosh darn.
sound.
You can hear both S1 and S2 pretty good here.
Is S1?
Okay. So that's the second intercostal space, left sternal border. If you want to put LSB for sternal border for your notes. Okay.
So then what do you?
LSB, not LSD.
I know.
What does it mean?
Left sternal border.
So then what sound is it?
S1 and S2.
Oh.
Yeah, you can hear them both pretty well evenly at this point.
So the aortic is just S2.
You can hear in all 5 of these spots, you can hear S1 and S2. It's just best to evaluate for S2 if you're suspecting a dysfunction of some sort. Here at the aortic, you can just hear it a little clearer.
So when we do our assessment, when you say the aortic, we're listening for S2 sounds, and then pulmonic is S1 and S2.
S1 and S2.
Oh.
So we're at the second intercostal space, left sternal border. We're going to go down another finger breath to the third intercostal space, and this should be
Herbs.
Herb's point. Okay, again, you can hear S1, S2. And then the fourth, pardon me, is going to be your tricuspid, your T.
So you're going down to the fourth, right?
Yep, fourth intercostal space, left sternal border again. Okay, that's your tricuspid. And then
Okay, what are you hearing?
Yeah.
S1, S2. Nope.
Okay.
Are they all just S1, S2?
Nope, we'll get you there, don't worry.
Get me there.
We're only on 4 of the 5, calm down.
There's one more.
I was gonna be like,
Right, and now this one I'm not going to use on Allie, I'll use on myself. But, you don't want to do nipple line because nipples can sag, breast tissue sags. Men have breasts as well and they could be flopping over. So, no, but seriously, you aren't going to be on the sternum anymore because that's basically the end of the sternum. You need to come over and out into the 5th intercostal space. Okay, so that's one more down from Herb's point, or actually the tricuspid. But now you're coming to the mid-clavicular line. So your clavicle runs from the shoulder all the way to about that substernal notch right here. Okay? And so right in that area there, mid-clavicular, goes down, and that is where you're going to find your mitral area, and that is going to be S1. And that is your PMI, and the same place as your apical pulse.
I was about to say.
That's why your apical pulse is the most accurate, because it's right off the heart.
Do you want us to, for when we do check off, hold it for a full minute?
I want you to verbalize it. If you were having to get an apical pulse, you would listen and count for a full minute.
Okay.
are we gonna listen, we don't have to listen to all of the spots? I mean, you would listen for 1 full minute at each spot?
I would listen to at least 3 or 4 cycles of the lub dub, lub dub, lub dub, just to kind of get an idea if it's nice and if it's regular or whatnot.
We don't have to know S3 and 4 yet, right?
Nope, just S1, S2.
I'm good with the lub dubs.
But I do want you to say, here I'm assessing at the apical point.
Or
Here I'm listing for S2. Here I'm listing for pulmonic. And I should hear S1, S2. Here I'm listening at Herb's point. I should hear S1, S2, tricuspid, and then mitral. Okay. Now, do we need to listen back here?
No.
Correct. Now, could you move on to when you do your head and tail? Absolutely. Even here, you can go just over to the side a little bit more, and you're listening to more lung than heart.
Oh, so you can
Okay.
kill 2 birds with 1 stone.
You got it. It's called bundling.
It's called bundling.
Yes, ma'am. All right, what else is on there?
Just
Oh,
safety.
pulses for the peripheral vascular. I don't know if it's.
It's not on here.
So,
It should
no one
be.
has insured patient safety.
We're done.
Well, no, because I want you guys to do pulses too. Because we did the carotid, so we might as well do the other ones. Okay. Now this one, I'll have you lay back. Ooh, she's got her poker socks on.
My dogs are
These are nursing socks. Oh, they are nursing socks though.
Compression.
Compression.
No varicose here.
Now, yes, I know, patient safety, side rails down, forgive me, okay? But this band don't work, she ain't going anywhere because she's fully alert and oriented, times 6. All right, so we've assessed her carotid pulses, we got good 2+ pulses there, okay? So the other places I'm going to check is her radial. Do not check with your thumb,
Nathan has a pulse.
right? So you want to make sure that you're feeling with your 2 fingers, your index and your middle finger. And I'm listening.
Oh my god.
I am palpating for
Pick up your chair.
Now I know how.
symmetry. So I want them to be equal on both sides. I want the rate to be regular. Okay. And I'm getting a good +2 on both sides. Okay. Next, some places might have you do popliteal next. Okay, which is just behind the knee. We're not going to have you do that. We're going to have you do dorsalis pedis, which is up here on the top of the foot. So in order to find that, Okay, I would take her sock off, but it's in between her big toe and like her pointer toe here, and you kind of just come up to about the highest point of her foot, because you have that little arch, okay? And you want to kind of work right in between there, and you should be able to feel a small, slight pulse. I can feel it.
Oh yeah.
Down lower.
You're a little bit high, but yeah. come
I know.
down.
I feel it.
Yeah.
I lost
Okay.
it. No.
But then along with that, I want to
Feet are clamming.
pinch your toes to see what?
Capillary.
Capillary.
Capillary refill, okay? And then the other one, the last one is back here. This is your post tibialis. So you feel the ankle bone on the medial aspect of the ankle, okay? And you go right behind that and kind of pull a little bit towards you to push that so that you're feeling the artery between the surface of the skin and her ankle bone. And you should feel pulses there too.
So just
Okay.
the radial, the dorsal pedis, and the posterior tibialis. That's it. No brachial. Okay.
Because if you have a pulse here, you're gonna have a pulse.
Oh yeah, duh.
That's why it's not
But I wouldn't
necessary.
have one here. If I do,
Well, if I didn't find one on her feet, on either of them, okay, and I didn't have a pulpler, I would then go to popliteal to see if there was still one.
oh, okay.
And then I would go get the Doppler and then come back to the
Just
feet.
the radial.
I think brachial.
Dorsalis, pedis, and post tip for your pulse points. Well, carotid, radial, excuse me, dorsalis, pedis, and post tips.
Yeah.
Yeah.
Okay.
Sorry.
Hips.